Hepatitis C is a viral infection. It affects the liver. This virus can cause serious liver damage. It's important to get tested if you think you might be at risk. Early detection is key for hepatitis C. When caught early, treatment is very effective. Don't delay, get tested today, your liver will thank you.
The hepatitis C antibody test is a simple blood test. It checks for the presence of hepatitis C antibodies. Antibodies are produced by your body to fight the virus. A positive result means you've been exposed to the virus. If you test positive for hepatitis C antibodies, an RNA test is the next step. This test measures the amount of virus in your blood. This is called the viral load. Knowing your viral load helps doctors determine the best treatment plan.
Liver function tests, often abbreviated as LFTs, check how well your liver is working. These tests measure the levels of certain enzymes and proteins in your blood. Abnormal results can indicate liver damage. A liver biopsy involves taking a small sample of liver tissue. It's examined under a microscope to assess the extent of liver damage. This helps determine the stage of liver disease. A complete blood count, commonly known as a CBC, is a routine blood test. This test is often one of the first steps in diagnosing various health conditions because it provides a wealth of information about the different components of your blood. It can reveal information about your overall health, including potential signs of hepatitis C. Hepatitis C is a viral infection that affects the liver, and a CBC can help in identifying some of the complications associated with this condition. One finding might be a low platelet count. Platelets are small cell fragments in your blood that are essential for normal blood clotting. Platelets are crucial for blood clotting. When you have a cut or injury, platelets gather at the site to form a clot and stop the bleeding. Hepatitis C can affect the bone marrow, where platelets are made, leading to a decrease in their numbers. This can result in a condition known as thrombocytopenia, which can cause easy bruising and excessive bleeding. Another possible finding is anemia. Anemia is a condition characterized by a deficiency of red blood cells, which are responsible for carrying oxygen from your lungs to the rest of your body. Anemia is a condition characterized by a deficiency of red blood cells, which carry oxygen throughout the body. This can lead to symptoms such as fatigue, weakness, and shortness of breath. Hepatitis C can interfere with red blood cell production, resulting in fatigue and weakness. This is because the virus can cause inflammation and damage to the liver, which in turn affects the production of red blood cells. An elevated white blood cell count is another potential indicator. White blood cells are a crucial part of your immune system, helping to fight off infections and other diseases. White blood cells are part of the immune system and help fight off infections. They come in different types, each with a specific role in defending the body against pathogens. When fighting hepatitis C, the body might produce more white blood cells, leading to an elevated count. This is a sign that your immune system is actively working to combat the infection, but it can also indicate inflammation or other complications related to the disease.
Dietary recommendations for hepatitis C. Eating a healthy diet is always important, but it's especially crucial when you have hepatitis C. Nourishing your body with the right foods can support liver health and overall well-being. Fruits are full of vitamins, minerals, and antioxidants. Berries in particular are packed with antioxidants that can help protect your liver from damage. Citrus fruits like oranges and grapefruits are rich in vitamin C, which supports the immune system. Vegetables are another excellent source of nutrients. Leafy greens, like spinach and kale, are packed with vitamins and minerals. Cruciferous vegetables, such as broccoli and cauliflower, contain compounds that may help protect the liver. Nuts and seeds are nutrient powerhouses. Almonds, walnuts, and flax seeds are great sources of healthy fats, fiber, and antioxidants. These nutrients support liver function and overall health.
Foods to avoid. While enjoying a variety of healthy foods is encouraged, there are some foods you should limit or avoid when you have hepatitis C. These foods can put extra stress on your liver. Alcohol is a major no-no. Alcohol is toxic to the liver, and having hepatitis C makes your liver more vulnerable to damage. It's best to avoid alcohol altogether. Foods high in saturated and trans fats can also harm your liver. These fats are found in fried foods, processed snacks, and fatty meats. Opt for healthier fats. like those found in avocados, nuts, and olive oil. Sugar and refined carbohydrates can also contribute to liver damage. Limit your intake of sugary drinks, processed snacks, and white bread. Choose whole grains, fruits, and vegetables instead.
Medical treatment direct-acting antivirals, DAAs. Direct-acting antivirals or DAAs are highly effective medications that can cure hepatitis C in most people. These medications have revolutionized the treatment landscape for hepatitis C, offering hope to millions of people worldwide who are affected by this chronic liver disease. DAAs work by directly targeting the hepatitis C virus, preventing it from replicating. By inhibiting the virus's ability to multiply, DAAs help to reduce the viral load in the body, ultimately leading to the eradication of the virus from the bloodstream. One commonly prescribed DAA is sofosbuvir. Sofosbuvir is a nucleotide analog inhibitor that interferes with the viral RNA polymerase, an enzyme crucial for the replication of the hepatitis C virus. Sofosbuvir is often combined with other DAAs, such as velpatasvir or daclatasvir, for optimal effectiveness. These combination therapies are designed to target different stages of the viral life cycle, enhancing the overall efficacy of the treatment. The typical dosage and duration of treatment vary depending on the specific DAA regimen prescribed by your doctor. Treatment duration can range from 8 to 12 weeks, and in some cases, it may extend to 24 weeks, depending on the patient's response to the medication and other individual factors. Another effective DAA is glecaprevir pibrentasvir, which is taken as a single pill once daily. This combination therapy is particularly convenient for patients as it simplifies the treatment regimen and improves adherence. This combination therapy has shown high cure rates across different genotypes of hepatitis C. Clinical studies have demonstrated that glecaprevir pibrentasvir can achieve sustained virologic response (SVR) rates of over 95%, making it a highly reliable option for many patients. Your doctor will determine the best DAA regimen for you based on factors such as your genotype, liver health, and medical history. It's important to have a thorough evaluation to ensure that the chosen treatment is tailored to your specific needs and circumstances. It's essential to take DAAs exactly as prescribed and to complete the full course of treatment. Adherence to the prescribed regimen is crucial for achieving the best possible outcome and preventing the development of drug resistance. Regular follow-up appointments with your healthcare provider will help monitor your progress and address any concerns you may have during the treatment process.
Surgical treatment and liver transplants. This chapter delves into the intricate and life-saving procedures involved in liver transplants, a critical option for those suffering from severe liver conditions. In advanced cases of hepatitis C, where the liver has been severely damaged, a liver transplant may be necessary. Hepatitis C can lead to cirrhosis, liver cancer, and ultimately liver failure, making transplantation the only viable option for survival in many cases. A liver transplant is a major surgical procedure in which the diseased liver is replaced with a healthy liver from a donor. This complex surgery involves removing the damaged liver and implanting a new, healthy liver, which can come from either a deceased or a living donor. While liver transplants can be life-saving, they are typically reserved for people with end-stage liver disease who have not responded to other treatments. End-stage liver disease can result from various conditions, including chronic hepatitis, alcoholic liver disease, and non-alcoholic fatty liver disease. The decision to undergo a liver transplant is made on a case-by-case basis, considering factors such as the severity of liver damage, overall health, and availability of a suitable donor. The evaluation process is thorough, involving multiple tests and consultations with a team of specialists to ensure the best possible outcome for the patient. Regular monitoring and follow-up care are crucial after a liver transplant to ensure the body accepts the new liver and to manage any potential complications. This includes frequent blood tests, imaging studies, and clinic visits to monitor liver function and detect any signs of rejection early. Medications are typically prescribed to prevent organ rejection and to support the function of the new liver. These immunosuppressive drugs are essential to prevent the body's immune system from attacking the transplanted liver, and they must be taken for life. Additionally, patients may need other medications to manage side effects and prevent infections. Recovery from a liver transplant can be a long and challenging process. Patients often spend several weeks in the hospital and require months of rehabilitation to regain their strength and return to normal activities. Physical therapy, nutritional support, and psychological counseling are integral parts of the recovery process. Despite the challenges, many liver transplant recipients go on to lead healthy, fulfilling lives. Success stories and patient testimonials highlight the transformative impact of liver transplants, offering hope and inspiration to those awaiting the procedure. Ongoing research and advancements in surgical techniques continue to improve the outcomes of liver transplants. Innovations in immunosuppressive therapy, donor matching, and surgical methods are making transplants safer and more effective, increasing the chances of long-term success for patients. Raising awareness about liver transplants and the importance of organ donation is crucial. Advocacy campaigns and educational programs aim to increase the number of registered organ donors, ensuring that more patients in need can receive life-saving transplants. Support groups and resources for patients and their families play a vital role in the liver transplant journey. These groups provide emotional support, practical advice, and a sense of community, helping patients and their loved ones navigate the complexities of transplantation and recovery.